I'm going to be your nursing student today performing a head-to-toe physical assessment. So first I'm going to perform hand hygiene. How do you feel today?
Good.
Good. And so you're a female, Caucasian. How old are you?
I'm 20.
20. And what's your first and last name?
Clare Salyer.
What your height and weight is?
Yes, I'm 5'6" and 118 pounds.
Okay, so 5'6", 118 pounds puts you at a BMI of 19, which is in the normal and healthy limit, because it should be under 25. So your dress, grooming, and hygiene all looks appropriate. Your general demeanor is very cooperative. Your affect is animated. Your thought pattern is logical, relevant, and organized. Speech is articulate. You're very alert. You've answered all my questions very nicely. Can you tell me my first name?
Yeah, Claire.
Yes. And do you know where you are right now?
Yes, I'm in Marion Hall.
Okay. Do you know what day of the week it is?
Thursday.
Yes. And do you know what we're doing right now and what you're doing here?
Yeah, so just like a general assessment.
Yes. Yep, so you're alert and orient times 3. Okay, so I'm just going to do some memory testing. Do you know who the president was prior to Joe Biden?
Donald Trump.
Yes. And what's my name?
Claire.
And can you interpret for me what the phrase means, an apple a day keeps the doctor away?
Just to like stay healthy, exercise, and help to go to the doctor.
Yes. How did you dress today since it was raining outside?
I had an umbrella.
Yes. Perfect. Okay, I'm going to take vital signs now on my patient Claire. So first I'm going to take your temperature, which is going to go in your ear, which is tympanic. So I'm just going to pull your ear up, out, and back. This in. Okay, so 98.6 is the temperature, which is good. Okay, I'm just going to grab your pulse if that's okay.
Yes.
So I got your pulse was 60 and your respirations were 16, which are both in normal range. Are you in any pain today?
No.
Okay, great. I'm just going to take your blood pressure really quick. Okay, so I got 110/64, which is a really healthy blood pressure. Okay, and I won't be doing a pulse ox today. Okay, now I'm just going to assess your head really quick. Your head looks appropriately shaped, and there's no trauma I'm seeing. It's symmetrical. Your hair looks evenly distributed. It feels firmly attached to your scalp, which is great. I don't see any scars or lesions or bumps on your scalp, so that's great as well. Okay, now I'm just going to assess your eyes.
Okay.
So if you could just stare straight ahead, I'm just going to look at them really quick. Okay, so they look like they have the proper alignment. appropriate prominence as well. And I'm just going to check for Perla. Okay, so I'm just going to shine this bright light into your eyes really quick. Just keep looking forward. Okay, so they were equally round and reactive to light, which is great. And then I'm just going to check for accommodation, so just follow my pen light. And watch it. Perfect. So now I'm going to check for extraocular eye movements. So if you could just follow my finger. Good. Just keep following it. Very good. Okay, so everything looks good with your eyes. Okay, so now I'm just going to assess your ears. So your ears look symmetrical. I don't see or feel any lumps or bumps. There's no scars or lesions present that I'm seeing, and no deformity. Your gross hearing is grossly intact. Do you have any hearing loss that you know of? Okay. Okay, now I'm just going to shine this light in your ears. I'm going to pull your ear up, out, and back. Looks good. Same over here, up, out, and back. Okay. Okay, so that was clear and intact. And everything looks good. Okay, now I'm going to assess your nose. Are you experiencing any congestion or drainage today?
No.
Allergies or anything like that? Okay. Do you have any difficulty breathing out of your nostrils? Okay. Do you have any difficulty smelling or with odors?
No.
Okay. So that should be grossly intact. Okay. Now I'm just going to look in your nose. If you could look up to the sky. So that looks, the mucous membranes look pink and moist. There's no drainage or blood that I'm seeing, so that all looks good. Okay, so now I'm just going to assess your throat. Okay, if you could stick your tongue out for me. And then if you could stick your tongue up to the sky. Okay. Okay, so your throat looked pink and moist, intact. There was no lesions present that I saw. I didn't see any missing or loose teeth. Do you have dentures? No. Okay, I didn't recognize an odor. And I'm not going to do gag reflex today, but if I did, I would use a tongue depressor and then move it back into your throat until you had a gag reflex. Okay, can you swallow for me?
Yeah.
Okay, perfect. So that was a positive for swallow test. Okay, now I'm going to feel along your trachea. Okay, so just for tracheal alignment, I didn't feel any deviation, and then I didn't feel an enlarged thyroid gland, so that's good as well. Okay, so now I'm just going to palpate your lymph nodes. Let me know if you have any pain or tenderness while I do this. Okay, so this is the preauricular, postauricular, occipital, tonsillar, submandibular, submental, and then superficial cervical, posterior cervical, and then I'll do a kneading fashion down for the deep cervical, and then supraclavicular. And I didn't, your lymph nodes were non-palpable. Did you have any pain while I did that?
No.
Okay, great. Okay, so now I'm gonna assess your skin. You need to put your mask back on. So I see appropriate flesh tone. I'm just gonna feel your neck really fast. Okay, so that was appropriate moisture. Your texture is smooth and normal. Your temperature is warm. Okay, I'm gonna check for skin turgor. So I'm just gonna pinch right here. And that snaps right back into place, so the turgor is good. And from what I see, there's no lesions present, so that's great. Okay, so now I'm gonna feel my patient's carotid pulses. that one is 3+ and strong. Okay, so that was symmetrical, 3+ and strong as well. And now I'm gonna listen to see if there's any bruit present. So if you could, when I say, just take a deep breath in and then hold it. Just take a deep breath. And then you can breathe out. Do it one more time. Check the other side. Deep breath in. Hold it. One more time. Okay. And there was no bruit present, so that's great. Okay, so now I'm just going to assess your heart. And I'm just inspecting across your precordium, and I do not notice any pulsations, which is good. Now I'm just going to feel at the different spots to see if you have any pulsations or thrills. So here at the aortic, no pulsations, no thrills. Pulmonic, no pulsations, no thrills. My Erb's point, no pulsations, no thrills. The fourth intercostal space, no pulsations, no thrills. And then tricuspid, no pulsations, no thrills. And then at the mitral, there is slight tapping, which is good, but no thrills present. And that's where your PMI is, so that's good. Your PMI was in the right location. It was the fifth intercostal midclavicular space. The rate was consistent with what we got on vital signs, rhythm regular. The diameter was appropriate, and again, fifth intercostal midclavicular space, or fifth intercostal space on your midclavicular line. And the duration was a faint tapping, which is good. Okay, so now I'm just going to listen to your heart. Aortic. Pulmonic. Erb's point. Fourth intercostal space. Tricuspid. A baby step. And to mitral. Okay, good. So I heard your S1 sound loudest at the bottom, S2 was loudest at the top, which is good. No extra heart sounds were noted. Your rate was consistent with what we got with vital signs, rhythm regular, strength was strong, and again, no extra heart sounds were noted, so that's good. Okay, so now I'm going to assess your lungs and thorax. Okay, so they look symmetrical to me just by looking. There's no deformity. The size and shape looks appropriate. Okay, can you shrug your shoulders for me? Good. So the strength was good there. Just checking across your clavicle. So that was a symmetrical level. Just gonna feel down your sternum as well. Okay. Let's see, so that was nice and vertical as well. Okay, so then if you could turn your head for me, I'm just gonna come under you, and then if you could take a deep breath. Good. So let's see. So that was an appropriate depth. It was deep. And symmetrical with excursion, so that's great. And then I don't see any lesions upon just looking, so that's good. Okay, so now I'm going to listen to your lungs for any adventitious breath sounds. If you could breathe deeply through your mouth, but no quicker than normal, and just move your head to the side there, that'd be great. adventitious breath sounds. I heard vesicular all the way through, so that's great. Okay, and your rate was consistent with your vital signs. Rhythm was regular. Depth was deep. You were non-labored. I didn't see any use of accessory organs, so that was negative. And again, no adventitious breath sounds, only heard vesicular. Okay, so now I'm just gonna do the back. Okay, so I'm just gonna inspect your scapula. That was even alignment. Just gonna put down your spine, cervical. Thoracic, lumbar, sacral. Okay, if you could sit up straight for me. And so I see concavity, convexity, concavity, convexity, which is good. So appropriate curvature there. Okay, so the anterior to posterior diameter is half of the transverse diameter, so that's good. Yeah, I'm just gonna go under right here. You can take a deep breath for me. Good. So the respiratory excursion was deep and symmetrical. I also don't see any lesions present on the posterior as well. Okay, and if you could cross your chest, your arms around your chest for me, I'm just gonna listen to your lungs on the back side. And then just take deep breaths like when I listened on the front, through your mouth, no quicker than normal. If you could turn your head to the side for me. Okay, good. So your rate was consistent with your vitals. The rhythm was regular. The depth was deep. Was non-labored. You didn't use any accessories that was negative, and I didn't hear any adventitious breath sounds as well, and I heard vesicular all the way through, so that's good. Okay, so now I'm going to do the abdominal assessment. I can see by looking that your abdomen is non-distended, which is great. And now I'm going to listen to the bowel sound frequency, and I'll be in your upper right quadrant there. And I'll listen for 1 minute. After listening for a minute, I heard 10 gurgles, which it's normal between 5 and 34, so that's great. Timer out there. And then I'm just going to percuss around your abdomen. so I got nice, good tympani all the way around, so that's good. And now I'm just going to palpate around your abdomen if that's okay. Let me know if there's any pain or tenderness with this. Okay.
No pain or tenderness.
Great. Okay. You don't have any scars, I didn't notice, on your abdomen. No lumps, no large organs I felt. And I wasn't going to go down to the bladder for modesty's sake. But again, the abdomen is non-distended, so that's good. And then we're also not doing the genitalia assessment, so we'll be skipping over that today. And you can go ahead and sit up if you'd like. And I'll do the musculoskeletal assessment. Do you have any joint pain today?
No.
Okay. I don't see deformity in your muscle or bones. That's good. Do you have any stiffness or decrease of range of motion? Okay. And your range of motion is grossly intact. Do you notice any creaking or crunching in joints when you bend down?
No.
Okay. So that's since you don't have any, that's negative for crepitus. Okay. So now I'm just going to assess your extremities. Just by looking at your arms and your legs, I see appropriate flesh tone. I'm just going to feel here, okay, warm, warm, warm. And for temperature in your legs, warm, warm, warm. So that's good. That was the appropriate temperature. And then I'm just going to feel your radial pulses. Okay, so those are strong, a 3+. And then for posterior tibial, strong as well, 3+, and then for your dorsalis pedis, those are both also strong and 3+, so that's good. Okay, those were symmetrical, and they were all present again, and 3+. Okay, so now I'm going to check your capillary refill, if I can see your hands. Okay, blanching, and then that was a brisk refill, blanching, refill, blanching, brisk refill. And since she has nail polish on her toes, I'm going to do it just above it on the skin. Just going to push down here. Blanching and brisk refill. Blanching, brisk refill. Blanching, brisk refill. Good. Okay, and then I don't see any edema on your hands. You can see your knuckles, your bony prominences on your feet as well. I don't see any edema present, which is good. Okay, so now I'm going to do a neurological assessment. If you could grab my hands and squeeze them for me. Okay, good. That was nice and strong. Can you pull my hands towards you? And then push them towards me. Good. We're going to do the same thing on your feet. You push towards you. And then pull towards me. Good. Okay. So, all good. The strength is strong for your upper and lower extremities, so that's great. And okay, so now I'm going to have you walk for me just to the couch is good. You just walk in a straight line, and then walk back. Great, you can have a seat. Do you have any difficulty or feel like hot or cold in your upper or lower extremities when you walked?
No.
Okay, so sensations are grossly intact, which is good. And now I'm just going to check your reflexes. So if you could make a muscle for me. Just find the tendon there. Use this. From there. Okay, you can relax. Okay, good. I'm going to do the same thing over here. You can make a muscle for me. Okay, you can relax. Okay, so now I'm going to do your lower extremities. And yeah, so I'll do your patellar.
Okay.
Just gonna tap right here and see if it reflex. Okay. Good. Okay. Okay. Yeah, so that all looks good. And then just to check for the end of our assessment, to check your short-term memory, do you remember what my name is?
Clare.
Yes. Okay, so that completes the head to toe physical assessment. Thank you.